what happens is a lot of times we think that cities, urban spaces are only meant for human beings. What we call stray dogs or street dogs are pets of the underprivileged. The Rajus, Tommies, Kalus, sometimes Salmans, Shahrukhs and Aishwaryas, they name them after their favorite film stars, are living on the streets. They are not a nameless, faceless creature just hanging around. They have their own idiosyncrasies, their histories and so on. These are the ones who actually look after them. The boot polish wala, the pan wala, the hawker, the policeman, the slum dweller, the street dweller, a person living in a building in a society. I could say they are also citizens that way of the city. But what happens is, of course, is that a lot of people may not think that they are, or maybe there might be bites because of various reasons, and one could be provocation, but we may not know that. Street dogs used to be killed from the late 18th century, and it was a legacy of the British, and this happened till about 1994. So in 1985, the Welfare of Stray Dogs founders realized that killing has no effect on the street dog population or rabies, and that is why they used to be killed. The municipal corporation vans used to round up the dogs, and they used to be taken to the killing pound of the municipal corporation in Mahalakshmi. They used to be kept for 3 days, and if nobody claimed them, they used to be electrocuted, or puppies used to be put in chloroform boxes. So what WSD started doing was that we used to actually rescue the dogs by paying a license fee and rescuing how many ever we could and releasing them, So this was the history. And then in 1994, with facts and figures showing that the number of dogs that they killed went on increasing, but rabies didn't go down, the population of dogs still remained, we convinced the municipal corporation that killing has had no effect on bringing down the population or human rabies deaths. And then that's when we converted the killing pound into a sterilization center. And on 26 Jan 1994, we sterilized the first dog in Mumbai. And as they say, that's history now. The aims and objectives of the welfare of stray dogs is to control the street dog population, but in a scientific and humane manner by running the animal birth control or the sterilization program. The second also is to promote the adoption of indies or street dogs or rescued animals. And the third, very importantly, is to ensure that the street dog or street cat population, the street animal population, is a healthy population by running vaccination programs and also healthcare programs. WSD covers the island city. So we cover from Kaf Parade to Mahim and Sayan for our on-site first aid program. The vaccination program, the rabies revaccination, we cover all over the city, even in the suburbs. And the sterilization program, now we've extended beyond the island city, because a lot of the street dogs have already been sterilized. A huge percentage coverage has been achieved. So we cover even like areas up to Chembur, Kurla, and so on. Over time, we must have covered at least about 3 lakh street animals, till date. But if you just look at last year, we've covered about 32,000 street animals. Our core activity or program is the sterilization program, which is also called the animal birth control program. Now this we run for street dogs and cats. Now what has happened is, in the areas that we covered, we have achieved considerable success by covering a large percentage of street dogs. And because of which, sometimes you interfere with nature and something else happens, the street cat population has gone up. So we now also do street cat sterilization. So the dogs or cats are brought to us at our center. They are operated upon. They are kept for post-operative care. And then once their surgical wound heals, they are put back in the same place they got from. The identification mark, to check is that there's a notch in the ear, a V, of course, which is done when they're under anesthesia. So that is our core program. We also have an on-site first aid program where we have 8 animal nurses and a veterinarian that go into different areas and treat dogs and cats on site. So for basic first aid requirements. I remember I had started this program when I trained under a veterinarian way back, and we treat animals with skin problems, with cuts, bites, maggot wounds, ear infections, eye infections, and this actually, you can treat on the street, so it frees up space at the center or in hospitals where severe cases can be admitted. Yeah, so we have trained nurses and a vet that go out and do that. We also run an outpatient department at the Shivri Center, where about 1,000 street animals, dogs and cats, are brought in by people for treatment, and they keep coming and following up. We do not charge anybody any money for anything we do, because finally the man on the street can't pay. He can't afford to spend on street animals, or sometimes even people who have pets who are underprivileged come and use this facility. And we have people who come from far-fetched areas like even, Virar or Mira Road or Thane, because they can put a cat in a basket in a train and bring it. It doesn't cost them that much. So at the center, this program is run. Then we have an adoption program where we put up dogs that require a home, where street dogs are fine on the street, but there are some abandoned pets. We rescue some dogs that can't be living on the streets, and we also have a category called airport dogs. What does that mean? These were dogs that were hanging around, street dogs that were hanging around in the airport runway. And many years ago, the airport authorities went to court and said that these are a risk to passenger safety, so allow us to shoot them. So we intervened in court and we said, don't shoot them. We'll take them and get them adopted. They won't go back. So these are the only dogs that don't go back. Otherwise, the others go back to their respective neighborhoods. And over time, we've had about 6, 7 such street dogs come in, and we keep getting them adopted. And we also run an education and awareness program, because it's very important to, one, reduce the dog human conflict that exists in a lot of places, and two is that to reduce dog bites and reduce rabies deaths. So especially we go to municipal schools, and in various languages, could be Hindi, Marathi, English, and we talk about being kind to animals, why dogs can bite, what to do when dogs bite, what is rabies, what is what is the Prevention of Cruelty to Animals Act, cruelty, how it is a cognizable offense. So all this awareness is done in various schools, colleges, in public places, and we have rabies awareness drives and on stations also, because it's very important to spread awareness. So these are all the various programs that we run. The sterilization program actually has helped bring down the street dog population. What happens is that there are no packs that are left, which means that no attacks happen. When there were packs, there used to be attacks, but that doesn't happen. The dogs are all vaccinated against rabies, so again rabies is not spread. And because of the sterilization, the problems associated with street dogs per se, like generally when a dog is on heat, that's when all the males will chase that dog, and they'll be fighting, barking, maybe somebody coming in the way will also get bitten. So even just that, one has eliminated that, by sterilizing the dogs. Figures have shown the dog population has gone down. Figures have shown that the rabies deaths have gone down drastically. I think in the last 5 years, 1 year or somewhere, there would have been one death. So, wherein when they used to kill dogs, there were over 40 to 50 people dying of rabies. 15 years ago, it was very difficult for us to convince people to take their animals away for sterilization, because who are you coming? Now, people themselves call and say, the dog population, now of course the cat population has gone up, but they call and say that, we have cats for sterilization, dogs for sterilization. Sometimes they also bring them in, So I think that's why it's very important that this program, which covers sterilization, vaccination, keeping the animals healthy, preventing zoonotic diseases, which with the vaccinations, it's actually beneficial for the citizens or the humans of the city. COVID was a very, very tough time for the for us humans also, and also for the animals, because remember that a majority of the animals or street animals depend on handouts from people. Now, people meaning restaurants, thelawalas, hawkers, people who are living on the streets. And COVID, actually, the city came to a halt, and there was nobody. So I think one thing that I saw is that people who have very little themselves actually, really went out and helped these animals. Of course, we also started distributing food that time to various people in different areas who fed the animals, because uh, people on the street didn't have food themselves. A lot of people didn't have jobs, so whatever little money they used to save from their salary to spend on dog and cat food, they couldn't. But I think that was a testing time for the street animals. And thanks to the people who just have very little themselves, they could survive. So I think one thing that I learned over time is that sometimes you have people who have enough for themselves, but they'll come and ask you that why you doing this for animals, why not human beings, where maybe they themselves may not be doing it for other human beings. But the man on the street who we interact with have never asked that question, that why are you doing it for them, why not us, because they themselves are doing it for the street animals. So sometimes this becomes dichotomous, because here you have people who have very little themselves who are doing so much.